So it's a surgical scoop used for scooping out or debriding or curating out um, tissues. Okay, usually maybe malignancy. So in where you are going to scoop out some tissue so that you can send it for biopsy, as you do it in endometrial curettage. Okay, so when it is any abscess cavity, some dead devitalized tissue at the base of the floor of the ulcer that can be scooped out using this scoop. Okay, or suppose you're doing a grafting, skin grafting. Before you put the skin graft, to freshen the surface of that granulation tissue, you can use this scoop for doing scooping out. Okay, and freshening up the surface so that the graft will take up well. Fine. It is also sterilized by autoclaving. Okay, so this one is a surgical scoop or a curette. Fine. It has got two ends. One is sharp and other one is blunt. Okay. Here in this case, both are looking sharp, but usually the new instrument, one side will be sharp and other side will be blunt. Wherever you're using it in friable tissue, it is preferable to use the blunt end. The one which is not friable, suppose there is some in the bone, there is some devitalized tissues or that which you want to curate the bone. So in that case, the sharp end can be used. Fine. These are two similar instruments. Okay. This is the back side of it. This is the front side of it. Okay. So you have to identify the instruments. Okay. One has, you see the longitudinal groove in this. Okay. And here also the longitudinal grooves are there, but you see the blade length is short. Here the blade length is long. Okay. So this is the longer one is a hernia dissector. Okay. So when you're dissecting you're doing a hernia surgery, and there is a sac which you're going to dissect it from the cord structures. So what happened is that you're going to insert it into the layers of the spermatic cord and open it. So since the groove is there, so you can use cautery or scissors to lay it open through this along the groove. Okay. So it is slightly difficult to imagine and understand. Okay. But it is once if you see any surgery, then you'll know actually what happens during hernia surgery and where it can be. We are not using it nowadays. Okay. With right angle forceps or any forceps can serve the work is to just to lift tissues. So any tissue is there like this, we are going to lift it with a artery forceps, and in between the two jaws of the artery forceps, we are going to open up. Okay, the same thing. Previously the work was done using this hernia dissector. Okay, the groove is there at the longitudinal groove is there in the middle. So once you lift up the tissue along this groove, you can lay open the tissues. You can cut open the tissues so that the coverings of the spermatic cord will be cut open, and you can identify the sac and dissect the sac from the other cord structures. Fine. That's a longer one. The shorter instrument is the thyroid dissector. Okay. So to dissect the superior thyroid pedicle, what we do is that we keep this instrument, once you identify the superior thyroid pedicle, we keep this instrument so that this part lies beneath the superior thyroid pedicle, so which will help in dissecting out the superior laryngeal nerve from the superior thyroid vessels and identifying it separately and ligating it away from the nerve so as to avoid injuring the nerve. Okay, so it is useful in that case. Both the instruments are sterilized by autoclaving. Fine. The first one was a thyroid dissector. It is also called as Cocker's thyroid dissector. This one is a hernia dissector. Sorry. Yeah. Anything else? The first one, first instrument, thyroid dissector. This one is the hernia dissector. This one is the thyroid dissector. Sorry. This is a hernia dissector. The longer one is a hernia dissector, and the shorter one is a thyroid dissector. The other name, it has got a name, that is Pocker's thyroid dissector. Okay, clear? Okay, I got confused. So we'll move with some instruments which are used in CTBS surgery.